So joining us with the latest as far as the overall perspective is concerned. But to better understand this, I'm being joined in by my guest this evening, Dr. Manoj Kumar Goel, head pulmonologist at Fortis Hospital, Gurgaon. Dr. Manoj, I appreciate you taking the time out and joining us here this evening. Let me begin by asking you this. What should we be making of this variant?
So actually, this variant is arising from the Omicron variant, which was there about a year ago. Like, till this point of time, the Omicron wave came after the Delta wave, and that time we didn't know how it's going to behave. It was highly transmissible. It was not lethal.
True.
It had a mild disease. So it's a descendant. It's the second descendant of that Omicron variant, and it is likely to behave the same way. The problem is that it is going to escape the immunity obtained from the previous viral infection or vaccination. It is going to escape that, and therefore it is going to infect the people, and it is going to be highly transmissible because it has spike protein mutation where it has increased efficacy or binding with the ACE2 receptors. Therefore, it is likely to be more infectious, more transmissible. But as it has been circulating since September, when it was first discovered in Luxembourg. And it's been there worldwide. Around 29% cases of new cases of COVID infections are due to this variant. This has been a very serious concern about it. It has not really caused any panic in the world or caused any serious disease. So it is going to be a mild variant. It will be transmissible. But yes, at one point of time, people who are vulnerable are likely to be affected and may get a serious disease.
Doctor, as you pointed out, since we're also talking about how, and my colleague was also drawing things into perspective about the Omicron variant as well, how different is it from this one? And with the fact that what factors could actually differentiate between the two, if you could talk to us on that front.
So the clinical parameter concerned, there is not going to be much of a difference. It's going to behave like any viral infection, like influenza-like illness. Okay. People would present with cough, fever, headache, sometimes vomiting, maybe loose motions and body aches. These would be the usual symptoms. They are not likely to have serious breathing difficulty or oxygen desaturation or any other complication as we saw in the Delta wave. So that is not likely to happen, except maybe in some exceptional cases who are vulnerable, old age people, more than 60 years of age with multiple comorbidities, heart diseases, underlying lung diseases, cancer patients, diabetics, renal patients. Maybe those would be likely to be vulnerable and may get a serious infection. So those are the people who have to be watched out. But otherwise, the trend shows that it is a mild disease, like any viral illness, like any influenza, which is a mild disease, and it will, it can be treated on its own. It is a self-limiting disease, may not require any specific treatment, just symptomatic treatment should be good enough for this also.
All right, Dr. Manoj, as you're putting things into perspective, I'm going to come back to you in a couple of minutes. I do understand, or rather guest Dr. Ishwar Gilada, Secretary General Organized Medicine Academic Guild, OMAG, is also joining us on the broadcast. Dr. Ishwar, I appreciate you also taking the time out and joining us here. Of course, Dr. Manoj was drawing things into perspective. But in your opinion, what could we really make of this variant?
Currently, what we see, we cannot call even wave. This is just a ripple effect. This is JN.1. We have few cases, mainly from Goa, there is a cluster. And this is a descendant of Tirola, which is BA.2.86. And in India, we already had BA.4 and 5, and that did not allow BA.2. So therefore, what we see is we need to watch properly, we need to follow properly. If it doesn't, we need to go with the trajectory. Out of infected people, how many require oxygen, how many require bed, how many require ICU, how many require ventilator, and how many people are dying. If death rate is low and all other requirement is also low, people get the flu-like syndrome and they recover in 3 to 4 days. I think we don't have to worry. Currently, we are having a lot of wave of also H1N1, H3N2 and respiratory syncytial virus. And therefore, sometimes it's a diagnostic dilemma, whether it is a COVID, whether it is a flu, whether it is a RSV. We do not know. Secondly, flu can be prevented, but the vaccines are very expensive. A lot of people don't take that vaccine. Even not 5% people are vaccinated against flu. Therefore, people will get flu, they will recover. And similarly, they will get JN.1 and they will recover, JN.2 and recover. Even WHO says this is a variant of interest. It's not variant of concern. So initially, when they study variant of interest. So they will watch with interest. Currently, nowhere in the world it is causing any havoc. There are number of cases increasing in Singapore and some places, and they have already been there in 38 countries. So, like monsoon comes from the south, goes to the north. Similarly, these cases are coming from the south, from Kerala, from Karnataka, from Goa, and it will go to north. What we can do currently is, rather than doing mass testing of people, which is expensive and it is creating panic, we should do a wastewater surveillance. Wastewater surveillance is that every city collects wastewater and they do wastewater treatment in a treatment plant. In that plant you do RT-PCR. If that wastewater collection shows positive from some particular area, for example in Mumbai, Ghatkopar shows positive or Chembur shows positive, then we know that there is infection happening in Ghatkopar and Chembur, nowhere else. And that tells you in 10 days in advance that after 10 days some kind of more infections will come. So and this is not a new technology, this is an old technique which was almost 1920, started in Ireland for seeing typhoid or enteric fever. So by doing that, we don't create panic, it is only lab work, it is only administrative work, and in the meanwhile we should prepare for the vaccine which will work also on JN.1, JN.2. The current vaccines, they do not work on JN.2 because this new subvariant has a vaccine escapade. Also previous infection escapade. And it is a little bit more infectious. But so long as it is only infectious, not causing morbidity and mortality, not taking people to the bed, I think we should not worry at all. We should use masks, better to be reverse masking, where people above 60, having comorbidity, having renal transplant, having cancer or on some kind of cancer treatment, they should be using masks to protect themselves. And we as young people, other young people from society, should protect our elderly people at home. And that should be the responsibility. And because New Year rivalry going to come, Christmas going to come, people are going to gather. And that we have seen in Goa, that from one event 18 infection came. So similarly, when there is an overcrowding, we should use masks. So there is no harm in using masks. That will also protect you from the ill effects of the environment pollution, other pollutants, other allergens, and even influenza and RSV which is going on. So using mask is a good strategy. Beyond that, we cannot do social distancing in a country like India, and hand hygiene and sanitization is a personal effect. You do not know whether somebody has done or not. But what is in your hand is to see that you are expecting people to use masks when they are in crowded areas.
Dr. Manoj, of course, Dr. Ishwar did speak about, the do's and the don'ts rather, but he's also made a very significant point with the fact that New Year's is around the corner, or even Christmas for that matter, which means that we will be seeing a lot of gatherings. Now, how does one really navigate into this? Because social distancing, in his opinion, is not something that's needed at the moment, but of course, there will be questions about masking up, also attending large gatherings, and more so about hospitalization. So if you could help our viewers better understand that perspective.
See, this clear that it is not going to cause a very serious disease. I mean, the trend shows it is not going to be a serious infection.
Okay.
But there is a vulnerable population, right? As we just talked about, those who have diabetes, cardiac diseases, elderly patients, they should definitely be wearing a mask and they should definitely be avoiding overcrowding. But as far as the young people are concerned who are healthy, fit enough, they should be, enjoying the festivities, meeting the people. But yes, maintaining a self-hygiene, hand washing. If somebody is developing some sort of influenza-like illness, particularly like cough, fever, then he should himself isolate. He should not be, venturing out and infecting others. So that is something that we can do. But we are healthy. We don't have any symptoms of, influenza-like illness. We can be going about it, doing our work. We can't stop that.
All right, Dr. Manoj, I appreciate you as well as Dr. Ishwar once again for joining us as far as everything that our viewers should know, and essentially, of course, about the variant and the driving factors of the same. We're going to leave the conversation at that. We're sipping a quick break here. More news coming up on the other side. Stay with us. We're going to be right back.